Our next speaker is Dr. Dalia Alabdulrazzaq. Dr. Dalia is an associate professor at Kuwait University, and she is a pediatric endocrinologist at Mubarak Al-Kabir Hospital. And her presentation, unfortunately, is virtual again. I would like to see her next time, inshallah, with us. And it will be about challenges and the management of diabetes children.
Good afternoon, everyone. It's a pleasure for me to join you again in this second lecture in this prestigious, important meeting. And I would like to thank the organizing committee for inviting me again to have a second talk in this conference. I would like to start introducing myself again. I am Dr. Dalia Alabdulrazzaq. I'm an associate professor at the Department of Pediatrics at the Faculty of Medicine and University of Kuwait. And for the next 20 minutes, I'll discuss with you some challenges in the management of children with diabetes. Now, the talk, in the next 20 minutes, this talk will be about real life experiences in the management of diabetes. Now, it won't be a review of literature and some scientific data. It is more about what is happening in real life with regards to management of diabetes and what are the challenges that we're facing. Now, because of the constraints of time, I have chosen challenges in two aspects on the management of diabetes. The first 10 minutes, I will discuss challenges in a special place. And in the second 10 minutes, I'll be showing you challenges in a special time. And then I'll end up with some take-home messages. Now, diabetes is a unique disease with unique challenges. And I have chosen the special place is school. I would like to show you some real-life experiences from our patients with regards to the challenges that they face when they go to school, and challenges in a special time. I have chosen to discuss with you our experience with regards to the challenges we faced in children newly diagnosed with diabetes during the COVID-19 period. Let's start with school. What is going on in real life? As I said, this is a real life experience, and I would like to just highlight that in management of children with diabetes, it is an interplay, in school specifically, is an interplay between school, the child, and the parent. And this is governed by the healthcare provider. From the perspective of the child, what are the challenges that they face when going into school? And this is one of my patients that I have obtained consent to share this video with you. I'd like to share this video with you. Okay, yes. He will talk to you about some of the challenges that he faced with regards to management of his diabetes when he goes to school. Sorry. Yes.
السلام عليكم، أنا عمر خالد، عندي 14 سنة، تايب 1 دايابيتس. الحاجة الصعبة أنا بشوفها السكر لما أكون في الصف، البمب يكون مثلا كاتشب لو أو باتري لو، بتزمر في الصف اللي هو أقل منه باتري لو أو كاتشب.
يأذيك أمر تنحرج.
بس الحاجة مثلا لما أكون في الصف يشوفون بس
تنحرج ها؟
So you see, Omar was 14 years of age. He's an adolescent. He was diagnosed with type 1 diabetes a few years back. Now, this video also taken a few years back. He was started on a pump, and he felt really embarrassed that he was getting these alarms from the pump in his class. He feels that eyes on him. So basically, he was really embarrassed by this, that there's a lot of interruptions from the pump, especially the alarms while he is at school. So this is an adolescent dealing with some of the challenges at school. Now, this is another patient that I'm following in my clinic, and he's of a school age. Let's see from his perspective, what are the challenges that he faced with regards to management of his diabetes at school specifically.
أنا اسمي عيسى، أنا فيني سكر ب4 سنين. الصبح كل ما أروح المدرسة أخاف أنقز وايد. أخاف يصير هبوط فكله أقل جرعة.
So Isa, he is the first patient that I have managed with type 1 diabetes when I got back from my fellowship. Now he's a sweet boy from a sweet family. However, at school, because of activity and so on, he and his mother specifically are afraid of hypoglycemic episodes when he is at school, and there is no support. The mother is not there or anything there to support him at school. So usually he tends to undertreat before going to school, and that had led to poor glycemic control later on. They're afraid of hypoglycemia and they don't get enough insulin. Okay, so this has been, these challenges are also shared by not only in kids with type 1 diabetes in Kuwait, but also in kids with diabetes elsewhere. So this is a study from the United States where they interviewed kids and they examined their perception of support and caring for their diabetes at school. And they felt the need for improved flexibility by teachers and nurses, such as letting them keep their meters with them all the time, and individualized care plans that might improve their ability to manage their diabetes at school. They said that they needed additional help and support to cope with hypoglycemic episodes, such as our patient, Asa. Now we have seen from the child's perspective, what are the challenges from the parent's perspective with regards to dealing with diabetes at school. This is my patient. This is the mother of one of my patients. She would like she will be sharing her take on the challenges.
أنا والدة فهد مريض سكر. أنا من المشكلات اللي بلاقيها مع فهد إن هو بيعاني إن هو مش عايز يقول إن هو عنده السكر. بيستحي جدا، ما بيقيس قدام زمايله ولا قدام أصحابه أو بالمدرسة أو كده. بس
يعني هذه مشاكل تواجه، يعني هذا الشيء بالمدرسة
إن هو عنده السكر مش بيحب، يعني دايما أقول له لا لازم تعرفهم وتعرف مدرسينك وكده، عشان يعني لو في أي حاجة صح يسعفوك أو كده. هو للأسف لا بيبقى مستحي، وحتى لما بيجي بيقيس سكره دايما بيقيسه متخبي جوه الشنطة ومش حابب يحكي لحد وكده.
So you see, this is the mother of Fahad. Her child Fahad has also type 1 diabetes for quite a while, and he's on a pump. He was going through also adolescence as well, and he felt really shy, and he didn't want to share that he had type 1 diabetes, afraid of being stigmatized. He doesn't want to tell his teachers, tell his friends, and he doesn't want to check or check his blood sugars in public. He was a bit shy and he didn't want to share this. So this is one of the challenges, and this has created a tension between the mother and the child that she struggled to convince the child that the teachers should know, your close friends should know, should anything happen, they will be able to help you and support you if his family is not around. So this is from the parent's perspective. And this is also similar to what have been published in the literature in other parts of the world with regards to parents' perspective about dealing with diabetes at school. Only 34% of parents believe that the teachers could recognize the symptoms of a mild hypoglycemia. This survey was done in Spain. 17% of parents experienced problems at their school, 5% not accepted because of diabetes, 8% were forced to change school because of the school cannot deal with diabetes, 9% had to modify glucose monitoring, and 16% treatment administration compromised because of lack of cooperation from the school. So they have real issues, especially in schools who are not equipped to dealing with these patients. Training session and increase in the number of nurses, better availability of resources, and improved communication between school personnel and parents were identified as key factors that might improve the care of these kids when they go to school. Now you see, school is an important part of these children's lives, and they spend a lot of time during the week at school. So management of diabetes at school is key to improve their quality of life and to ensure getting proper achievement. Now we have seen from the child's perspective, the parent's perspective. What about our diabetes educators? They see a lot of parents, a lot of families, a lot of children with type 1 diabetes. This is one of our senior diabetes educators that would like to share her take about the challenges that these children face at school.
Assalamu alaikum. I'm Nihal Taha. I'm a senior diabetes educator at the Small Diabetes Institute and a certified pump trainer. What we are facing in Kuwait with our children with diabetes in schools, that they have a lot of peer pressure and fear of being stigmatized by their colleagues. So mostly they are afraid to announce that they have diabetes. They do not monitor their blood sugar in public or take their injections in public. Sometimes they are also afraid of having hypos at school. They also, some of them are facing problems with the administration, teachers or administration, in being cooperative with letting them into extra bathroom visits, in taking extra snacks during hypoglycemia, in allowing them to participate in physical activity, which sometimes affect our children psychologically. I hope we have taken a lot of measures to try to avoid this. And also the school health department in Kuwait have done a very important role, which we will highlight later.
So this is one of our diabetes educator talking about her perspective on challenges in management of children at school.
Assalamu alaikum.
So what is going on in terms of school? What are the school nurses experience with type 1 diabetes and dealing with these kids? A lot of studies have done, and this is some of the literature, that school nurses' perception that these school nurses, this has been done in Germany, the school nurses had surveyed perceived a moderate level of self-efficacy in providing diabetes, and there was a significant relationship between higher scores, self-efficacy score, and having related to having a specific, well-constructed diabetes curriculum, which was found in limited numbers in schools in Germany at that time. Other study as well had shown that these school nurses had lack of access to knowledge about dealing with type 1 diabetes, and they have a lot of time constraints because limited number of nurses dealing with a lot of kids, and the majority of school nurses agreed that the use of electronic medium will significantly enhance care and improve knowledge and communication with regards to management of kids with type 1 diabetes. Now, this is a population-based register study that was done in Sweden, and they have it involved more than 5,000 Swedish children who developed diabetes between July of 1977 and 2000, and they compared these diabetic kids to non-diabetic children, and they found that despite a well-developed diabetes care system, still they did not succeed in preventing the disease from affecting school achievement in children with diabetes. Among children with a young age at onset and therefore longer duration, the negative effects were greater. So what are we doing about it? How we are trying to improve the care of children in schools? This is what we're doing in Kuwait, and this is courtesy of Dr. Hassa Al-Kandari, who's the head of the Kuwait Diabetes Society, and also the head of the Pediatric Council at the Ministry of Health in Kuwait. We have implemented the IDF Kids project, Kids and Diabetes in schools here in Kuwait. My school is diabetes friendly, and this is so we have implemented a project that involves awareness campaigns for students and families, training the teachers, training the school nurses, and training specific school doctors to be there in terms for support of kids with type 1 diabetes and help in caring and management of these kids during their stay at schools. And also they took it a step further, is that also because of the increase in obesity and in order to fight type 2 diabetes as well, awareness campaign and training to fight obesity in kids by promoting healthy food in school canteens and promoting curricular and extracurricular physical activities at school as well. And also there is a supplementary material in Arabic that is provided for the school personnel and also for families as well to help educate these families and also school nurses and doctors in terms with dealing with type 1 diabetes in general in these kids during their stay at the school. So we have talked about challenges in management of diabetes at school, and this is the second aspect that I would like to to share with you a real life experience of what we have faced with regards to management of children newly diagnosed with diabetes during the COVID-19 period. And this is the study that we have published recently in 2021 with regards to studying this aspect during the COVID-19 pandemic. Higher rates of diabetic ketoacidosis and admission to pediatric intensive care unit among newly diagnosed children with type 1 diabetes in Kuwait during the COVID-19 period. So this was a cross-sectional study that involved newly diagnosed children with type 1 diabetes during the pandemic compared to the year before, 2019. Now in Kuwait, we have the COVID-19 pandemic was declared in February of 2020. So the COVID-19 pandemic period was defined from February 2020 to February 2021, and we compared to the same period in 2019. And as you see, there was no significant change in there was no significant change in the number or incidence between those who were diagnosed in the pre-pandemic period and the COVID period. However, we found that most, compared to the pre-pandemic era, the kids newly diagnosed with type 1 diabetes during the pandemic were more likely to be admitted to the PICU and present with DKA. Now, the possible causes are likely multifactorial. There is unknown biological factors that COVID-19 might have on diabetes and newly diagnosed children with type 1 diabetes. There is recent literature that maybe it affects the beta cell and maybe affect incidence and presentation. Also, the likelihood of the more numbers of DKA during the pandemic might be related to delay in seeking medical care. Now, these families are afraid to go to hospitals and afraid of contracting COVID-19. Also, this pandemic was, especially the first year, was extremely stressful on families, and there was lack of recognition maybe of symptoms during a stressful period of time. So this might have led to increased DKA in these kids. Also, admission to PICU was high, even though that we didn't have severe DKA, higher DKA compared to previously. But this is maybe decreased because of low threshold in admitting these kids to the PICU in a time of unknown where we didn't know much about COVID-19. So as you see, now, during a time where the country and all the health authorities were directing their resources into management of the COVID-19 pandemic, our kids with type 1 diabetes were being admitted with higher DKA rates, and which is an acute complication that has impact on morbidity and mortality, and also requires its own attention and on resources as well. So this was a challenge for diabetes care providers to dealing with these kids, an increase of these kids during the pandemic, where all the resources or most of the resources and the attention was given to COVID-19. So this was of the challenge on the healthcare system at that time. And we found that COVID-19 was a factor leading to higher DKA rates and PICU admission when accounting for other confounding factors, as you see here by the table. COVID-19 more likely to be admitted to DKA, not related to severity per se, but related also to higher PICU admission during the COVID-19. Now, during the COVID-19 period, what are the factors that has been associated with DKA, severe DKA, and PICU admission? We found that family history of diabetes was a protective factor. So as you see here, family history of diabetes, those kids who had positive family history of diabetes in a first-degree relative, and they were newly diagnosed with type 1 diabetes during the pandemic, they're less likely to be admitted with DKA and less likely to be admitted to PICU. So you see here, public awareness, family education is key and important. This has been also replicated in the pre-pandemic area as pre-pandemic period as well. Family history were those with to be admitted to DKA as well. So you see how family history of diabetes was important. So here, in order to face the challenge of management of kids newly diagnosed with diabetes in the time of pandemic, there has to be awareness, family education, and support for these families in this stressful times. And we have to have a plan for the future. This will not be the last pandemic that we will face, and we have to plan to deal with these kids in the future in order to support them during stressful times. So I would like to end with this message. Enhancement of care curriculums, awareness programs, as well as improvement of communication between families, children with diabetes, and healthcare teams are crucial in the care of diabetes during special challenging situations. And thank you for listening. And this is my email. I'll be happy to receive your feedback, your questions and concerns in this email. And I'm looking forward to joining you in the Q&A session. Thank you.